Good afternoon, everyone. Welcome to today's webinar hosted by the American Academy of Pediatrics and healthychildren.org. Today, we'll offer some tips to help improve your family's overall heart health. We'll also share information about a high cholesterol condition that children can inherit from their parents or grandparents. It can put their health at risk even if they eat a healthy diet and live an active life. Now let me introduce our host, Dr. Jennifer Shu. She is a practicing pediatrician, author, and mom in Atlanta, a frequent guest on national and local TV, radio, and web-based programs. Dr. Shu is the co-author of many AAP books, including Heading Home with Your Newborn and Food Fights. She is also the medical editor of healthychildren.org. Of course, we're the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you so much for having us today, and happy Valentine's Day to everybody. This is a perfect time to talk about heart health. And joining us today from Virginia is one of my colleagues, Dr. Brad McQuilkin. Dr. McQuilkin is a pediatric cardiologist with the Children's Hospital of Richmond at Virginia Commonwealth University. He is also a member of the AAP section on cardiology and cardiac surgery and a member of the Virginia AAP chapter. Welcome so much, Dr. McQuilkin.
Thank you for having me.
So today we're going to talk about high blood pressure and high cholesterol, which seem like adult conditions, but how can they affect kids also?
So we usually think of high blood pressure, also known as hypertension, as a problem that affects adults. But in fact, this condition can be present at any age. An estimated 2 to 5% of all children and teens in the United States have high blood pressure. However, this condition often goes undetected and untreated. If high blood pressure isn't identified at a young age, it can go undiagnosed for years, eventually leading to organ damage or other health problems like coronary artery disease in adulthood. High cholesterol can be related to diet, exercise, or lifestyle, but it can also run in the family. Children can be affected when they're young, and it can affect them when they're older or in adulthood. We'll talk about screening for these conditions a little later as well.
So it sounds really important to be aware of these things early on because it can impact everyone later on in life. So for the next slide, what are some things that parents can do to support heart health for the whole family?
Sure. So nutrition is important. Eating a balanced diet of healthy foods like whole fruits, vegetables, and whole grains, making water your drink of choice, and limiting access to sweet drinks such as 100% fruit juice, sodas, sport drinks, or fruit drinks as much as possible. And try to avoid ultra-processed foods. These are everywhere, and they're very hard to avoid, of course, but just do the best that you can, as your schedule allows, and just try to limit their access as much as possible. Exercise is also important. Kids need physical activity built into every day, and whether that's playing sports, playing outdoors, helping with family chores, walking or biking to school, engaging in physical education, taking a family walk, or really any other activity that they enjoy. Indoors, you can try active gaming or online fitness classes to strengthen muscles, to build coordination, and to release tension. Creating a family plan, a family media plan is also very, very helpful. Kids and grown-ups too benefit from sensible screen time limits that make room for other healthy activities. You can engage your kids in creating a plan for the whole family to follow, and a family media plan can also help prevent media use from interfering with adequate sleep. And lastly, stress management is very important. So just like exercise, kids will follow the example that parents set for them. If your work, school, or social schedules are jammed with so many commitments that there's no room for healthy downtime, just consider maybe what you can let go. And rest and relaxation, most importantly, rebuild the body's systems after the challenges of a tough day or week. So reserve time for them and encourage your kids to do the same.
Yeah, so important for everyone in the family to be following these guidelines. So let's talk about exercise. How does regular exercise impact heart health, and what activities might be best for families?
Sure. So the AAP recommends kids 6 years and older get at least 60 minutes of physical activity a day. And the physical activity should be moderate or vigorous if possible. Think of activities that make your heart beat faster, get you breathing faster, or make you sweat. Some activities in the week can be activities that build muscle too, like climbing or jumping. And recreational activities are great, but organized sports are also a good way to keep kids active. Active plays such as throwing a ball, hopscotch, jumping rope, or a game of tag are great exercise as well. And parents and caregivers can join in with their kids by going for a walk, a hike, or a bike ride. And when parents participate in sports or workouts, kids are more likely to do so themselves.
And I always love multitasking. So if you can involve maybe walking to school because you have to get to school anyway, or walk the dog because the dog also needs exercising, you can do many things at once. So let's talk a little bit about diet. Are there certain dietary recommendations that promote heart health in kids?
Yeah, a heart healthy diet from an early age lowers cholesterol, and if followed through adolescence and beyond, should reduce the risk of coronary artery disease in adulthood. So eat a diet high in fiber and rich in calcium. Include low-fat dairy foods such as yogurt, milk, or cheese, and limit fast food or takeout food, and try to limit eating out at restaurants. In a heart-healthy diet, it doesn't have to be expensive, so try these family-friendly tips. With fruits and vegetables, look for in-season produce, which is more likely to be on sale. If you have freezer space, buy frozen vegetables without added sauces or butter, or try canned fruit, canned in 100% fruit juice and vegetables with low sodium or no salt added on the label. For grains, make at least half your grains whole grains if possible. Maybe pop your own popcorn rather than buying the prepackaged bags. And choose hot cereals like plain oatmeal or whole grain dry cereal, and try to skip the sugary ones. Um, with protein, beans and peas are good sources of protein, and they're often less expensive, and you can use them as sides or you can use them as your main dishes. Try family-sized or value pack meat and then freeze what you don't use. And consider canned tuna, salmon, or sardines. These store well, and they're a low-cost seafood option. And dairy, of course, try to choose low-fat or fat-free milk, which has just as much calcium but fewer calories than whole milk or 2% milk. And consider buying the larger size of a low-fat plain yogurt and spoon that into smaller containers, and then add the fruit of your choice. And try to choose cheese that is reduced fat or low fat if possible.
So I think those looking at the labels can be so important. I love that it's really easy. You can look for low fat on the label, low sodium or no salt added. And you made a good point of looking for canned fruit in 100% fruit juice and not in syrup. So really good points, practical points to think about. Thank you for that. So what about family history? Is there a role that family history plays in determining a child's heart health?
Yes, family health history is very important because it gives clues to your child's future health. So it's important that adults know their own cholesterol levels and let their pediatrician know if their own personal levels are high. And so cholesterol has different categories. Total cholesterol is the sum of all cholesterol in your body, but it's also broken down into good cholesterol, which is called HDL or high density cholesterol, or bad cholesterol, which is called low density or LDL cholesterol. And so we recommend, and the AAP recommends, that all kids get screened for both high blood pressure and high cholesterol. Screenings for high blood pressure are recommended at age 3, but preemies or children who are in the NICU may need this screening earlier. The AAP also recommends that all children between 9 and 11 years of age have cholesterol screening, but cholesterol screening may be needed earlier at age 2 if your family history includes parents or grandparents who have had heart attacks or were diagnosed with diseases affecting the blood vessels, such as stroke, particularly if these diseases were present at age 55 or earlier for men or 65 or earlier for women. If parents or grandparents have total blood cholesterol levels at 240 milligrams per deciliter or higher, early screening is important. If your family health background is not known, such as if you have adopted children or you were adopted yourself, early screening is helpful. But also, if your family has characteristics that are associated with heart disease, such as high blood pressure, diabetes, smoking, or obesity. And so, for specific levels, if your total cholesterol is 170 milligrams per deciliter or below, that's usually okay. But if your total cholesterol is 200 or above, then that's too high. And so for the LDL or bad cholesterol, if your level is 110 milligrams per deciliter or below, that's okay. But if your LDL is above 130 or above, that's too high.
Excellent. And those are definitely things your pediatrician can talk to you about when they do the screening. So yeah, really important to consider family history as well. I'm going to pause for a second and introduce our second speaker, who is unavoidably delayed. We have today with us also Dr. Christopher Snyder, who is past chair of the American Academy of Pediatrics section on cardiology and cardiac surgery, and professor of pediatrics and the chief of pediatric cardiology with the Children's Hospital of Richmond at Virginia Commonwealth University. Dr. Snyder is also a member of the Virginia AAP chapter. Welcome, Dr. Snyder.
Welcome, and let me apologize for being a few minutes late, but as we all know, when patients always come first. So
Absolutely.
thank you all for allowing me to join.
We're glad you could join us. I'm going to throw this next question straight to you then. We're talking about kids who have high cholesterol, but when it's not related to diet, exercise, or lifestyle, what does this mean?
Well, these kids can have a genetic condition called familial hypercholesterolemia, or what is commonly referred to as FH. If this is the first time that many of you are hearing of FH, because as pediatricians we rarely deal with cholesterol issues, you're not alone. Millions of people worldwide live with familial hypercholesterolemia, and really only about 30% of them know that they have it. Kids with familial hypercholesterolemia, or FH, have a mutation in a genetic code that gets in the way of removing the extra cholesterol that the body doesn't need. As a result, cholesterol builds up in their arteries. This buildup, called plaque, can lead to heart attacks in an older age and strokes. There are two forms of FH, or familial hypercholesterolemia. There's heterozygous familial hypercholesterolemia, or HEFH. And this is really the most common, getting it from one parent. A child with heterozygous familial hypercholesterolemia is an inherited abnormal copy, really, from one of the parents. The other is homozygous familial hypercholesterolemia. This is really rare and happens when children inherit an abnormal copy of the FH gene from both parents. This is a very serious form of hypercholesterolemia, and this one's the one that Dr. McQuilkin and I don't really love to see, but this one's really bad, and this is one of the reasons why the AAP would recommend getting a cholesterol level on somebody who's a younger age, and really at about 2.
Excellent. Before we move on to the next slide, Dr. McQuilkin, is there anything you'd like to add to that?
No, that was an excellent summary. Yeah. And so patients who do have familial hypercholesterolemia, it's a very, serious disease, and it needs, immediate attention and management.
So for the next slide, we'll start with you, Dr. McQuilkin. What treatments or interventions are available for children with this homozygous familial hypercholesterolemia?
Sure. So the first and most important treatment is medication. And so statins, a class of medicine called statins, can reduce the amount of cholesterol that's made by the liver, while also helping the liver remove cholesterol that's already in the bloodstream. Other non-statin medications also work with the liver, the small intestine, and specific chemical pathways to help lower the bad or LDL cholesterol in the bloodstream. And so for folks with homozygous familial hypercholesterolemia, a process called lipoprotein apheresis, which is an infusion process that removes LDL cholesterol directly from the blood each week, can be helpful. But along with medication, of course, eating a heart-healthy diet, staying active, and avoiding smoking or tobacco products is very important throughout your child's life.
Dr. Snyder, anything you'd like to add about treatments or interventions in this population?
Yeah, I think that treatments are relatively new. I mean, there were statins back when Dr. McQuilkin and I were cardiology fellows, but they were not recommended in kids. We put a rare teenager or a late adolescent on it. Now all of these statins have been proven to be very, very safe in pediatric patients, and it's not the same old statins anymore. And they are many of them are recommended all the way down to 12, and we've gone younger than that. So it's not anything for y'all to think that this is a really serious medication. These medications are used in tons of adults and lots of kids also.
Good to know. That's very reassuring. So next question for Dr. Snyder then. Where can parents find reliable resources and support for managing both homozygous familial hypercholesterolemia and general heart health?
Yeah, if your child is diagnosed with homozygous familial hypercholesterolemia, your pediatrician generally will recommend one or more medical specialists that focuses on heart health and lipids, such as a pediatric cardiologist, a lipidologist, or an endocrinologist. A dietitian is also extremely important to your child's care team to help offer guidance and suggestions to maintain a healthy diet. All of these providers care about your child and can answer many of the questions in the treatment plan. And this is really becoming very important. It's all about a team. And then the Family Heart Foundation is also an excellent resource for families with familial hypercholesterolemia. They are a leading organization in research, advocacy, and education for those with a genetic risk for heart attacks and stroke. You can find a wide range of excellent material and resources, including Care Navigation Center at thefamilyhealth.org.
Okay, great. Familyheart.org sounds good. What about Dr. McQuilkin? Anything you'd like to add?
No, just working closely with your care team and using resources available to you, help you understand and manage issues, as well as you can.
So that brings us to our next slide, Dr. McQuilkin. What are some questions that parents and caregivers can ask their pediatrician at their next visit regarding heart health?
Sure. So again, partnering with your child's doctor and healthcare team can help you create healthy heart habits that are good for the whole family. So you can ask your pediatrician and physicians about ways to improve healthy eating habits, physical activity, and stress management routines, tips for things like setting regular family meal times, and how to create a treatment plan that emphasizes good health today while also shaping skills that will benefit your kids long into the future.
Before we go into the Q&A session, Dr. Snyder, anything else you'd like to add?
Yeah, I think that most kids with high cholesterol do not have a inherited form of high cholesterol, even if their family does. There's genetic testing for this. And then it's also part of, I know it's part of mine and Brad's routine is we always ask the family who is getting the unhealthy foods. It's always the mom or the dad. We tell them to try and cut down on some of that stuff. We don't want kids to never have a sweet or a little bit of ice cream, but I think everything in moderation will help with this outbreak of hypercholesterolemia that we're all seeing.
Excellent. We thank everyone for submitting some questions. We got some during this session as well as in advance. We did get several questions about milk. People want to know about what is the recommendation for switching from whole milk to lower fat milk, and how do you balance that with the need for, brain development from the fat versus could you start lower fat milk earlier if you're concerned about high cholesterol?
Yes, and so just in general, using whole fat milk through infancy and into the preschool years is certainly okay, but usually as kids, get to 2 or 3 years and beyond, it's helpful to switch to 2% milk or less fat milk, particularly if you have a family history for hypercholesterolemia. And if you have familial hypercholesterolemia, it's certainly better to use low-fat milk earlier on.
Dr. Snyder, anything to add on that?
No, I agree, and I think that this will also help us battle a little bit of our obesity epidemic that we're seeing. Is we cut out the fat in the milk and go to really low fat or no fat milk earlier. The earlier, the better.
Dr. Snyder, another question about diet. Is there anything, maybe even a supplement or oats, for example, that can help lower cholesterol? What about vitamins, omega-3 fatty acids? What can you tell us about that?
Yeah, omega-3s are proven to help lower triglycerides, and I've had a couple of patients with elevated triglycerides and put them on omega-3s. Um, Oats, they always say they lower cholesterol. Cheerios says it lowers cholesterol, and that. I mean, if you have high cholesterol, there's not a bad option, but there also isn't really a great option. If your cholesterol is really more than 20%, you can lose about 20% of your high cholesterol with exercise and diet. But much beyond that, there's not a lot. So if you have a kid who has a cholesterol of 200, it's a really good option. If their cholesterol is 300, it's only part of the option, and there are other things, and they really need these medications.
Mm-hmm. Dr. McQuilkin, anything to add there?
No, I think that it was excellent advice, and just maintaining a healthy lifestyle in the way that we all should, and keeping our activity and diet balanced will help with cholesterol in the long run.
Dr. McQuilkin, are there any warning signs that parents might see in their young children that could mean that their child has high cholesterol?
Most of the time, no, which is why it's very important to visit with your pediatrician and be sure that you have cholesterol screenings regularly. Sometimes patients with homo-zygous familial hypercholesterolemia, whose cholesterol levels are extremely high, can sometimes have deposits of cholesterol in their skin called xanthomas, which are sometimes visible, but oftentimes not. And so, visible physical signs are often hard to see.
Dr. Snyder, anything to add there?
Yeah, I agree with Brad. I think that this is where the beauty of being a pediatrician, we are truly the public health officers for the United States. And when you examine a child and you have any suspicion and you're looking at their parents and their parents have, white lines around their eyes, or they have puff around their lower eyelids, or they have anything else, that's usually when those kind of conversations come up to me as a subspecialist.
Yeah, it really shows the importance of keeping up with those well child visits. I think so often our children are healthy or seem healthy, and a checkup does not seem necessary. But this is where we catch important things like high cholesterol that you can't necessarily see. Dr. Snyder, what about cholesterol ranges in children? Are they the same as the limits that we use for adults, or how are those determined?
Yeah, they're the same. And because we're pediatricians, we tend to look the other way a little bit on these. But I will tolerate a child who is otherwise healthy playing basketball or a sport. Parents don't have high cholesterol. I'll tolerate their levels to be 200, 210, but I caution them that they have to exercise, and I always send them to a dietitian to help. It's surprising how many families don't realize that unprocessed food and things like Popeye's fried chicken, although I love it, it is not really good for your cholesterol, and donuts and things like that. And so I tolerate, and I'd love to hear what Brad has to say, but I tolerate them a little bit higher in kids who are healthy and active and not smoking than I would in a sedentary adult person.
Good to know. Dr. McQuilkin, what would you like to add on that?
Yes, agreed. And I usually look at the bad or the LDL cholesterol levels more specifically for starting medication above diet and exercise. And so, if your LDL level is 150 or 160 or above, that's usually the threshold where most people consider starting medication.
Okay, Dr. McQuilkin, let's go to you again. What can you tell us about kids who maybe sneak in candy or chips or other, bad foods? Maybe they're getting them from friends at school. What can you do about kids who sneak these that the parents don't even know about or aren't controlling?
Sure, that's always a hard one because all of us have to do some things that maybe aren't so healthy for us every once in a while, right? So, but just like Dr. Snyder was saying, just trying to maintain overall lifestyle balance and involving families with kids. And so, if families are doing things together and they're establishing routines and they're establishing patterns, kids are most likely to maintain those patterns that their family does, and they're less likely to sneak things or do things that maybe aren't as healthy for them.
Dr. Snyder, anything you'd like to add?
Yeah, no, when I see kids with a high cholesterol, I always tell them that there is a time for them to be a kid. And so I always tell the family that they can have a little bit of this or a little bit of that. But I also tell the families not to buy it when they do the grocery shopping and then go out for it if they want it. You're never going to be able to keep a kid from sneaking stuff at school, but unless the child is eating most of their meals at school, that's probably not contributing dramatically to their high cholesterol level. It's more of the things that they're getting at home.
Good point. And then sometimes I will, maybe around Valentine's Day or Halloween or holidays like that, sometimes I will trade a toy or a book or an activity in exchange for my kids' junk food.
Yeah.
And so sometimes swapping out for something that's not a food item can be useful. Let's talk about, let's see, is there an exact number of cholesterol, total cholesterol number that you would definitely treat in children? Because sometimes I'll send children to see the cardiologist locally and they'll have a level of 350 and they won't start on any kind of medication. So what number are we looking at?
I think it depends on the breakdown. Um, kids tend to have really high HDL levels, and here we're getting a lot of referrals in for high cholesterol, and their cholesterol is 210, and their HDL is 85, 90, 95. I saw a kid who had an HDL of 112. And so, to me, I agree with what Dr. McQuilkin said a couple minutes ago, where it's really their LDL level is more of the focus. If they have a really high HD level, it can drive their total cholesterol up. So to me, it looks more at their LDL, and then I sprinkle in a little bit of triglycerides. And then I always make sure that I don't treat on one because especially if somebody's a super high one time, you don't know if they had something before. And then so I will always tell the family, look, make sure you don't have anything to eat or drink before you go get your cholesterol checked again.
So
I'd start
fasting,
anybody at 300, almost anybody for sure.
so fasting cholesterol really does make a difference. Is what you're
Yes.
saying?
I think the AAP has it right where they check a cholesterol first, and it doesn't have to be fasting. But if you're coming to a subspecialist like Dr. McQuilkin or myself, we're really going to want a fasting one.
Okay, good to know. Dr. McQuilkin, what would you like to add there?
Yes, yes. So total cholesterol, 300 or above does make me a little worried, of course. But looking at the LDL, it's often a more specific way. And if folks are at LDL levels of 170 or above, that's when I strongly consider medication management, particularly
Okay.
if diet and lifestyle has not been effective.
So let's say if I see a 2-year-old in my practice and they have a family history of high cholesterol and I screen them and they might be a little bit high, how soon do they need to be screened again?
I guess it depends on family history. If one or both parents, do have familial hypercholesterolemia, probably screening at 6 months or a year is helpful. If families are not known to have a familial type of hypercholesterolemia, probably, for a 2 or 3-year-old, once a year would be okay.
Okay. And would you like to see them in your practice right away or once they hit that 300 total cholesterol, high LDL mark?
Sure. If the family has familial hypercholesterolemia, I think it's helpful and important for the family to see a cardiologist, a lipidologist, or an endocrinologist. But if there's not a specific family history, then pediatricians can follow kids, very well, unless the cholesterols get high enough to consider possible medication management.
Yeah. Dr. Snyder, anything you'd like to add there?
Yeah, I agree with that, and I also think that um, it we might be a little better at ordering some of the genetic testing for this. I think pediatricians can certainly order it. It's going to kind of depend on where you live. If you're living in the middle of nowhere and you don't have a subspecialist for 500 miles, you're going to have to take care of this on your own. And if there's a family history and you get a child who has an elevated cholesterol, I would probably order the genetic screening, which is relatively easy to walk through. But if you're in a town the size of New York City and there's a pediatric cardiologist on every corner, you're probably better off to just refer.
Good to know. And I think a lot of cardiology offices do have a geneticist available, right?
Yes.
Dr. McQuilkin, anything you'd like to add?
No, I think that was very succinct.
Okay, Dr. McQuilkin, I feel like patients are often looking for that magic bullet. I know we talked about some supplements and oats before. Is there anything else that we can do to try to keep our kids' cholesterol in a healthy range?
Really just doing the things that we all should do to be healthy, just maintaining moderate activity, a healthy diet that's high in fruits and vegetables and low in processed foods and foods that are fried, is most efficient and helpful to maintain, the cholesterol levels for your kids and for the entire family, in an acceptable and healthy range.
Dr. Snyder, do you agree on that one?
Yeah, I was recently at an American Heart Association meeting and they were talking about cholesterol, and one of the younger researchers got up and said, we wouldn't be having this conversation if we did what we knew we were supposed to do, which is exercise, eat healthy, mostly fruits and vegetables, and nobody smoked. And he said cholesterol would not be a problem for anyone other than the familial heterozygous hypercholesterolemia patient.
So
Homo-zygous.
not the most glamorous response, but things that we all know we should do and try to stick with. What
Yeah.
about protective factors? Like you had mentioned, having high good cholesterol or the HDL. How does that work? And are there any other protective factors that might be good to keep in mind?
I think right back to the same things: exercise, plenty of sleep, and not smoking, because smoking is a really dangerous one for your cholesterol. So to me, those are the things. And then and exercise will raise your HDL. Sleep will help raise your HDL. So it's really trying to get that number up and do what we know we should be doing.
I hadn't realized about the sleep. That's good to know. Sleep helps in so many ways, even, with growth, with behavior, with your immune system. Dr. McQuilkin, anything you'd like to add there?
Yeah, no, absolutely. Balancing sleep, exercise, and diet is good on so many levels, and cholesterol is just one of the things, that benefits from that.
Dr. McQuilkin, we got a question about butter versus margarine. Any thoughts on one being better than the other, or certain brands that you would recommend?
Sure. So margarine has a lot of trans fat in it, and trans fats can form more extensive or dangerous plaques just overall. So just in general, if you're choosing between butter or margarine, probably butter is a little more helpful to decrease plaque formation, over time.
Dr. Snyder, I have one final question before we close things out. What about lipoprotein A? Is that related to anything we've been talking about today?
Yeah, this is a relatively new field in adult cardiology where lipoprotein A, they've identified it as really a big marker for a really bad type of cholesterol. Um, I personally don't know much about it. Brad may know a little more. I haven't seen tons of patients. I haven't ordered this, and it's not indicated as far as I know of in a pediatric patient, but Brad, do you have any thoughts on that?
Yeah, so lipoprotein A, is definitely more studied for adults, and folks and patients who do carry lipoprotein A abnormalities may be more vulnerable to higher cholesterol, but not at the levels of familial, heterozygous, or homozygous hypercholesterolemia.
Excellent. Thank you for all that good insight and for joining us today. I'm going to turn the microphone back over to the AAP.
Great. Well, thank you so much, Dr. Shu, Dr. Snyder, and Dr. McQuilkin. That was really great information and certainly very timely this month, being Healthy Heart Month and Valentine's Day. We would like to thank you all for joining us. And pardon me, I am going to get to the correct slide, and we are at it. Okay. We'd like to remind participants to register on healthychildren.org for our e-newsletter, personalized homepage, and special offers. And please follow us if you're interested on Instagram, Facebook, Threads, and Pinterest. Also, subscribe to our new Healthy Children podcast. Listen to it wherever you get your podcasts, or go to healthychildren.org/podcast. We hope you enjoyed today's webinar. You'll be receiving a short survey from us soon. Please let us know what you found helpful and what suggestions you may have. And a special thank you to Regeneron for their support of this webinar. Thanks again for joining us, everyone.